Welcome to today's deep dive into healthcare analytics. Data analysts play a crucial role in extracting meaningful insights. And one way they do this is by monitoring key performance indicators or KPIs. In this video, we will explore 14 essential healthcare KPIs, their formulae, and how data analysts use them for informed decision making. These are some of the KPIs that we are going to cover in this lecture. The first KPI we are going to cover is patient satisfaction rate or PSR. PSR is calculated by dividing the number of satisfied patients by the number of respondents, then multiplying it by 100. PSR reflects how satisfied patients are with the care they receive. Hospitals use PSR to identify areas for improvement in patient care services. It helps in enhancing patient experiences and loyalty. The second KPI is average length of stay or ALOS. ALOS measures the average time a patient spends in the hospital. The formula is total number of patients days divided by the total number of admissions. ALOS measures the efficiency of the hospital operations and resource utilization. Hospital administrators use ALOS to assess the effectiveness of treatment plans and optimize bed turnover, ultimately improving the resource allocation. Another KPI is bed occupancy rate or BOR. BOR indicates how efficiently hospital beds are utilized. It's calculated by dividing the total inpatient days by the product of the number of beds and number of days. BOR indicates the efficiency of bed utilization within the hospital, and hospital managers use BOR to ensure optimal use of the beds, preventing overcrowding or underutilization, which can affect the patient care and revenue. Another important KPI is readmission rate or RR. RR assesses the percentage of patients readmitted within a specific time frame. The formula is the number of readmissions divided by the total number of discharges. RR assesses the effectiveness of the patient care and prevention of the avoidable readmissions. Healthcare providers focus on reducing the RR to enhance patients' outcome, improve care transitions, and control healthcare costs. Another important KPI we have is admission rate or AR. AR calculates the number of admissions per population. We divide the number of admissions by total populations and then multiply by 1000 for a standardized rate of AR. AR provides insights into the demand for the hospital services relative to the population. Healthcare planners use AR to anticipate resource needs, plan for the capacity, and allocate resources effectively in response to changing demographics or health trends. Another KPI, revenue per patient or RPP. RPP gauges the average revenue generated per patient. We have to divide the total revenue by the number of patients in order to get the revenue per patient. RPP indicates the financial performance of the healthcare facility on a per patient basis. Hospital finances teams use RPP to evaluate the profitability of services and identify areas for revenue enhancement or cost control. Another KPI, cost per procedure, CPP. CPP evaluates the average cost incurred for each medical procedure. It's calculated by dividing the total cost by the number of procedures performed. CPP or cost per procedure assesses the average cost incurred for each medical procedure. Healthcare administrator and financial analysts use CPP or cost per procedure to optimize the resource allocation, negotiate contracts within the suppliers, and identify cost-saving opportunities. Another important KPI is Physician Efficiency Ratio or PER. PER measures the productivity of the physicians by dividing the number of patient encounters by the number of physicians. PAR thus measures the productivity of physicians by assessing the patient encounters. Healthcare organizations use PAR to optimize the staffing levels, improve workflow efficiency, and enhance the overall productivity of the medical staff. Another KPI is medication error rate or MER. MER assesses the accuracy of the medication administration. We calculate it by dividing the number of medication errors by the total number of medications administered. Medication error rate assesses the accuracy of the medication administration. So, patient safety is paramount, and healthcare providers use MER to identify areas of improvement in the medication administration process and thus reduce the errors and enhance patient safety. Another important healthcare KPI is emergency department wait time. Emergency department wait time measures the time a patient spends waiting in the emergency department before receiving the care. We calculate it by subtracting the arrival time from the time of initial treatment. Hospital focuses on ED wait time to improve the patient satisfaction and ensure timely care. If the wait time is expressive, it will lead to patient dissatisfaction and impact patient outcomes. By monitoring and optimizing ED wait time, healthcare providers can enhance the overall patient experience and ensure timely interventions. Another important KPI is appointment adherence rate. This KPI assesses the rate at which the patients adhere to the scheduled appointments. We calculate it by dividing the number of attended appointments by the number of scheduled appointments. This KPI thus assesses the rate at which the patient adhere to the appointments. Healthcare facilities use the appointment adheration rate to manage patient schedules effectively. If adherence is low, it may lead to inefficiencies, increased wait time, and lost revenue. By analyzing this KPI, healthcare providers can implement strategies to improve patient communication, reduce no-shows, and enhance overall appointment adherence. Another important KPI is operating room utilization. OR utilization measures the efficiency of operating room usage. We calculate it by dividing the total time surgeries are performed by the total available or OR time. OR utilization thus measures the efficiency of operating room usage. Hospitals aim to optimize the utilization of the operating rooms to maximize efficiency and minimize downtime. If the utilization rate is low, it may indicate underutilization of the resources, whereas high utilization may lead to scheduling conflicts and delays. By monitoring OR utilization, healthcare facilities can ensure efficient use of the surgical resources and improve overall operational efficiency. Chronic disease management rate. This KPI evaluates the effectiveness of managing chronic diseases within the population. We calculate it by dividing the number of patients within the control condition by the total number of patients with chronic disease. Population health management is critical for preventing complications associated with the chronic diseases. If the management rate is low, it may indicate a need for targeted interventions, patient education, or improved care coordination. Healthcare organizations use this KPI to enhance chronic disease management program and improve the health outcomes for the population. Preventable hospitalization rate. This KPI assesses the rate of hospitalizations that could have been avoided with proper outpatient care. We calculate it by dividing the number of preventable hospitalizations by the total number of hospitalizations. This KPI thus assesses the rate of hospitalizations that could have been avoided with the proper outpatient care. To reduce the healthcare costs and improve patient outcomes, providers use the preventable hospitalization rate. High rates may indicate gaps in the outpatient care, preventable services, or chronic disease management. By assessing the root causes healthcare organizations can decrease the preventable hospitalization, enhance patient well-being, and optimize resource allocation. These KPIs thus offer a comprehensive view of the healthcare performance. Data analysts can leverage these metrics to drive improvements in patient care, operational efficiency, and final outcomes. Thank you so much for joining us on this exploration of the healthcare analytics KPIs. If you found this video informative, please like and subscribe for more content on healthcare data analysis. The complete KPIs, their formula and significance is given in the cheat sheet, the link of which is given in the description. Please do not forget to check that out. Thank you.